Hi there, this is Dr. Olson, just wrapping up the series, Differential Diagnosis Made Easier, not made easy. What we're going to be talking about today is cluster B, or what was traditionally known as cluster B personality disorders. So I want to just give a little clarification in this. Um, Something that's occurred on the University of YouTube that really bothers me is that everybody you don't like is a narcissist, and I'm sorry, that's just not the case. We all have traits, or you would have a personality. There has to be definite social and or occupational impairment for somebody to be diagnosed with anything. Okay, and that doesn't mean that, they just annoy you. So let's go ahead and share the screen. Okay, so one you hear a lot about is borderline personality disorder. So let me begin by sharing that these cluster B personality disorders, as they are, uh, or at least were definitely referred to as, are all shame-based disorders. So when you get snotty and judgmental with people who have personality stuff, please know that this is really, it comes from shame. And yes, I know it's incredibly hard to deal with, especially if you were raised with a parent with these traits. But it doesn't come from the place you think it comes from. It doesn't come from, I want to be mean, I want to own the world, that kind of thing. It comes from an underlying shame. So let's talk about borderline to start with. Frantic efforts to avoid abandonment, unstable and intense relationships. Okay, so we usually see in a borderline relationship there's like a lot of fanfare at the beginning. It's usually very dramatic, and it's not uncommon at all for that person to absolutely idealize that person, the new person that they've met. Oh my god, this is the best dude I've ever met in my whole life, and he's fabulous, and he's everything, and he's the things that nobody else has ever been to me. And then he faux pas. Okay. And then all of a sudden he's Satan, the Antichrist, and he must be, done away with, which usually again occurs when the person feels threatened by abandonment. Okay. Narcissists and borderlines are magnets to each other, which we'll talk more about in a minute. Because remember that more than anything, the borderline fears abandonment. Okay. And so when relationships start to cool, which they do, if you haven't seen my series on the stages in a relationship, please look at that. They personalize this. A borderline personality will absolutely personalize this because they have a very unstable self-image. Okay. They tend to be impulsive. So let's say a borderline goes through their partner's phone, which wouldn't be an uncommon thing. Again, not because they are trying to be nosy or intrusive, but they are terminally afraid of being abandoned. And they see a text from a woman. Okay, it's going to go from 0 to 60 really, really quick, because the assumption is that you're going to leave me, that you're playing me, that you're going to abandon me, and do you know how much that hurts me, and I am going to say and do things to you because I'm feeling hurt and I'm feeling threatened. And then the same person finds out that the message was from their new supervisor, whose name happens to be Patricia. Okay. And then they end up feeling really ashamed about how they responded and how they behaved. But for the borderline, feelings are reality. Okay, so I felt it, therefore it is. Okay. And these feelings are super intense in the moment. That's why we do a lot of DBT, dialectical behavioral therapy, with these folk, because we need to decrease the intensity of those emotions in that moment. This is the time where some people will cut, engage in other self-destructive behaviors. They might attempt suicide because, again, in that moment, that feeling is overwhelming. That anguish that grief, that loss, that fear, that panic is just overwhelming. And there's this sense that it's not going to get any better, that I can't tolerate this mood episode, that I can't tolerate this mood swing. We see paranoia, transient though. So being like ultra suspicious of somebody, or dissociation. If you've ever seen the film Fatal Attraction, go back and watch it again, the one with Glenn Close. There's a scene where she's clicking the light off and on and off and on and off and on. And she's very much in a dissociative state in that moment. So I'm terrified. So I push you away. Then I feel abandoned when you do exactly what I think you're going to do. There's a lot of testing behavior that'll go on with borderlines. So I'm going to test your limits, see if you are really going to leave me, because my prediction is you're going to leave me anyway. And when I think you're going to leave me anyway, I might say or do things to elicit that. Okay. Histrionic personality. So these folks are really uncomfortable when they're not the center of attention. So this could be at a dinner. This could be even at the family dining room table. If they're not the center of attention, they might do things to make themselves the center of attention. They might also be kind of pouty because nobody's talking about them. Their behavior can be seductive or provocative. Okay. So histrionic folk, again, tend to use their physical appearance as a way to garner that attention, but might also be the very same person who says, I don't understand why men look at me. And they're wearing the Daisy Dukes and low cut tops, that all those things that very much are going to attract that kind of attention. And again, that's not victim blaming. I'm not saying that. What I am saying, though, is that when you dress in a seductive manner, you're going to get a different reaction from people. They have rapidly shifting and shallow expression of feelings. It tends to be very dramatic. So, you're my best friend and I just love you. And the other person is going, I hardly know you. Okay. Uses physical appearance in a dramatic presentation. So everything is very dramatic and over the top. And let me tell you a story about this, and this. And oh, this person is just so horrible. Let me share with you why. Everything is very dramatic. They also tend to be very suggestible and consider relationships closer than what they actually are, because they don't really have much of a capacity to be truly close to people. And underneath this shame-based disorder is the sense that I am everything or I am nothing. Narcissistic personality disorder. Again, this is the YouTube favorite, that everybody you don't like has narcissistic personality disorder, which kind of makes me chuckle, because sometimes when people are writing it, I have to scratch my head and wonder. So at the core of narcissistic personality disorder is I am everything or I am nothing. Let me say that again. I am everything or I am nothing. They do constant comparisons. They assume that others are envious of them because they are envious of everybody who has something that they don't have. It is a constant comparison. Now, most people recognize that that's not an attractive trait, and so they're going to keep it to themselves, but it'll come out sideways. Grandiose. They can be in a room, a dinner with all lawyers and be the only non-attorney there, and will still be trying to tell them how to do law or how to practice law, because they're very grandiose. They really do believe, without commiserate experience, that they know better than everybody. Excuse me. They tend to be preoccupied with fantasy. They require excessive admiration, okay, and entitled to special treatment, despite lacking in commiserate accomplishments. Again, they want to be, well, yeah, we even see this sometimes again on YouTube, where they want to be the expert on narcissistic personality disorder. but they have no training, schooling, anything to suggest that that's an appropriate title. Now, that's not to say everybody doesn't have a story and it isn't worthy. Of course it can be all those things, but like I myself, I don't do a teaching on law. I'm not a lawyer. I don't have those experiences. I have my own opinions about law, but I really don't have that training that would suggest that I'm in a position to do that. They tend to be interpersonally exploitative. Okay, so they're seeking narcissistic supply, people who will validate them, who will provide them with that special treatment, people who make them look good. And what's really sad is that narcissists will tend to get married to somebody who is very kind, somebody that they initially will love bomb. They show them lots of attention, respect, and then pretty quickly start taking them down brick by brick. Okay? Because the possibility of you leaving me when you have absolutely no self-esteem is much, much less. They have little or no remorse for pain inflicted. When you talk to these people, guys, they will, this person had it coming, you deserved it, I'm looking out for your best interest, and the victim is always blamed, or rationalization is used, and it doesn't matter how it doesn't make sense, or to a person on the outside looking in, would say, oh my gosh, that's completely unreasonable. To the narcissist, they know it all and they're correct. The antisocial personality disorder, failure to conform to social norms, laws, deceitful, impulsive, irritable, aggressive, reckless, irresponsible, and lacking of remorse. But know that they also have the traits of the narcissist. This is, in my opinion, an antisocial is a violent narcissist. Okay. Narcissists tend to be more savvy. Well, in fact, let me go ahead and show you the differential that I came up with that hopefully will help you in practice. Okay. So, borderline personality, they experience extreme mood swings, but they have intense remorse and shame. Okay. So when they do something that's, oh, I'm thinking about the example of the client that I had who, she thought her husband was cheating and put up a picket sign outside his work. After she did that, she had extreme remorse and shame. And it absolutely may elicit self-destructive behaviors. Okay, narcissists don't feel that. They don't feel extreme remorse and shame. Borderlines do. In fact, in those moments, they often will tell you that they just want to die because that remorse and shame is just too much. Histrionic, they use personal appearance and performance to maintain the center of attention. Narcissists, they're entitled, often intelligent, exploitative with little or more remorse. Their behavior's rationalized. White collar federal. Okay, so you're much more likely to find the narcissist in white collar jobs and in federal prison. Okay, whereas the antisocial, they tend to be more violent. They often are not necessarily as intelligent as the narcissist. Not always, though, and often less socially graceful. So they are blue collar. They're at the state level. This is Charlie Manson. Okay, who again is violent, but goofy as hell, and people pick up on it. Very, very blue collar. And again, the blue collar folk tend to end up in state prisons, whereas your Bernie Madoffs, who cause as much, if not more, harm, are going to often end up in federal prison. And again, their behavior they rationalize to themselves. Okay. All right. So this is the end of this series. I hope you got something out of it, and I hope that it makes diagnosing easier for you. If you're looking for any other types of discussion as far as differential diagnosis, let me know. I'm always open to it. So thanks. Have a good weekend. Bye-bye.